Deepika.
Okay, Perry, stay on with us. Some more breaking news coming in. The health department will not be doing any random testing on infants admitted to other government hospitals due to respiratory illnesses or any other special tests, even if they have symptoms of HMPV infection, as it is already an existing virus and is non-fatal, is what we're learning. So, no random testing on infants in government hospitals. Berry, take our viewers through the details.
Yeah, ever since this, the news of these two infants who have been diagnosed with HMPV infection, virus infection broke out, there was panic among members of the members in general public. They thought that there would be a lot of infants or other people would have caught this infection like the COVID times. And this was the time it was they were asking the government as to whether random testings would be done on patients, especially infants who have respiratory ailments admitted to the other hospital. To which the health minister Dinesh Gundarao said that no random testing whatsoever for any other infants or other patients in other hospitals who have similar conditions, since he explained that this particular virus, the HMPV virus, is not a new one, but an already existing one to which we have medications for, and treatment is possible, and this is certainly not a fatal virus that had mutated or genomed in China, which is causing fatality. So this is an already existing virus that is affecting infants with lower immunity. Lower immunity is what they say. So there will be no testing whatsoever, random testings whatsoever on any patients admitted to the government hospitals, even if they have symptoms of HMPV virus, is what the minister said. He also categorically said that the samples of the already admitted baby boy from the Baptist Hospital also will not be sent to the National Institute of Virology, as he also is to be discharged in a couple of days' time, because he will recover from this particular condition, Devika.
Okay, I want to also bring Dr. Chawla back in on this particular update before we move on to other breaking news. Dr. Chawla, do you agree with this decision of the government at this point in time? At least the Karnataka government has decided not to hold any sort of random testing on infants in hospitals that have been admitted for respiratory illnesses.
I want to just reassure my countrymen, it is not that bad. The good news you showed, the third month, a 3-month-old child has already been discharged, and the other also doing good. So that only means, because in India in winter months we are used to respiratory infections which are in the form of flu or pneumonia types. So the two existing vaccines in India, one the influenza vaccine which is available, and one is the pneumococcal vaccine, which are very well available. I would advise all the vulnerable group, including the people who are 60-70 plus types, and all the people who have comorbid diseases, they better, instead of just fearing this new virus, they take these vaccines. That will be far more beneficial, and look after their general health otherwise regarding their diet and other things. Per se, as far as my information goes, because it is almost 6-7 channels since morning I'm speaking, and nothing seems too bad, although people draw civilly with the situation in COVID-19 in 2020 and 21. So kindly do not, nothing to panic, just precautions and follow-up of COVID-19 protocol. That should be good enough for all of us.
Okay, all right. Thank you so much, Dr. Chawla. We have some more news now coming in. After calling for an emergency meeting with the Health Department in Karnataka, State Health Minister